Hi, my name is Laura. Today I would like to talk about the topics of becoming unemployed and physical health across disadvantaged and less disadvantaged area in England. Health is an important contributor of inequality because health-relevant resources are distributed unevenly, such as in deprived and less deprived area. Employment is another contributor of inequality because employment people may have greater access to both economic and social resources, such as greater disposable incomes. Social causation and health selection are the central themes in the study of employment transition and health. For social causation, studies test the effects of becoming unemployed on the change in physical health, while for health selection, study tests the effects of physical health on becoming unemployed. This study seeks to integrate both the perspective of social causation and health selection to advance our understanding of physical health across deprived and less deprived areas in England. Area differences have received less attention when examining the association between employment transition and health. For example, the association between becoming unemployed and health among people who live in deprived and less deprived areas. Studies have focused on gender, socioeconomic status, and other factors. There are empirical evidence for the association of employment state and health across deprived and less deprived areas. However, this study were not able to address the possibility of selection bias due to the use of cross-sectional data. This study addressed selection bias by looking the questions of are people with poor physical health in different areas more likely to become unemployed. This study have two goals. The first one is to test the effects of becoming unemployed on the change in physical health across people who live in deprived and less deprived area. Second is to test the effects of poor physical health on becoming unemployed across people who live in deprived or less deprived area. I argue that becoming unemployed may trigger the development of poor physical health, especially for people who live in deprived area. According to the perspective of collective resources model, residents in less deprived area were healthier than residents in deprived area because residents in less deprived area have more health relevant resources such as social support, health services. Losing the benefit of employment may be associated with poor health. Job loss is relevant to stigma of unemployment, financial hardship, and loss of work roles. Meta-analysis shows that CRP and fibrinogen were increased among job seekers compared to employed people. The association was stronger in Wales and Scotland than in England. These results suggest that physical health of job seekers were poorer than employed people. The effects are stronger in deprived area, Wales and Scotland, than in less deprived area, England. Although research have tested the effects of mental health on becoming unemployed, area differences have not been examined. I argue that people with poor health in deprived area are more likely to be unemployed compared to people in less deprived area. The reason is that people with poor health were more likely to transition from employment to unemployment. Also, people's life chances for economic activity, such as employment and unemployment, are relevant to the area where they live. This study have two hypotheses. The first one is becoming unemployed decreased health compared to when being employed. The adverse change in the health of unemployed people are stronger in deprived area compared to less deprived area. The second hypothesis is people with poor health are more likely to be unemployed. Adverse change in physical health increase the possibility to become unemployed in deprived area compared to less deprived area. Analytic sample of this study were drawn from wave 2 to wave 10 of understanding society. The indicator of employment deprivation from national statistics were used to group local authority districts in England. FF12 physical health component summary is the dependent variable of this study. FF12 physical component summary consists of 4 domains, including physical functioning, role limitation due to physical health, bodily pain, and general health. The score range from 0 to 100. Lower score represent lower physical functioning. Employment status is the independent variable of this study. The option were grouped to employed and unemployed. Employed was coded as 0 and unemployed was coded as 1. Employment deprivation is the moderator of this study. Employment deprivation measures the proportion of people who would like to employ but are jobless because of unemployment, having health problems, or having caring responsibility. Employment deprivation were grouped into 5 quintiles. 0% to 20% represent least deprived area, while 80% to 100% represent most deprived area. Its educational qualification, limiting long-term illness, ethnicity, gender, household income, and marital status is the control variable of this study. This correlate will control because these control variable will link to employment transitions and physical health. Fixed fact model were used to test the association between employment transitions and change in physical health. Fixed fact models test only within individual differences, discuss the information about differences between persons. Table 1 is the descriptive statistic of this study. From table 1, we know that physical health of people who live in the least deprived area is 50.80, while the score for people who live in median area is 49.62. The physical health score of people who live in the most deprived area is 48.32. This result suggests that people who live in less deprived area are more healthier than people who live in deprived area. There are 11.78 people who live in the least deprived area are being unemployed. Well, they were 21.85% of people who live in median area are being unemployed. There are 27.77% of people in the most deprived area are being unemployed. From this result suggests that people who live in deprived area are more have high possibility to be unemployed. Table 2 is the fixed fact model of employment transition. This table focuses on social causation. In model 1, we know that becoming unemployed is not significantly associated with physical health. From table 2, we know that living in the second least deprived area improve health. In model 2, we also know that physical health reduced 0.37 point among unemployed people who live in the second most deprived area compared to people who live in the least deprived area. Table 3 is the marginal effects of the interaction effects. In table 3, we know that physical health increased from the 52.60 point when being unemployed to 52.46 point when being unemployed among people who live in the least deprived area. Table 4 is the fixed fact model of employment transition. This table focuses on health selection. From this table, we know that the odd ratio of becoming unemployed increased among those whose physical health score improved in median area. But this finding will not affect the finding of social causation. The main finding of this study is becoming unemployed improve physical health among people in less deprived area, but reduce physical health among people in deprived area. This means the main finding confirms the belief that unemployed detrimental to health, especially for people who live in deprived area. Differences in the nature of job and health resources in deprived and less deprived area may explain the paradox. People in deprived area may work in manual or physically demanding job before being unemployed. Also, people who live in less deprived area could use health resources such as health services in their residential area. The main finding was not influenced by health selections. To track the main finding, future study can test the associations of manual job and area to see the distribution of manual job in deprived and less deprived area. Practitioners in deprived area should focus on people who make the transitions into unemployment. Discuss with this client the way of maintaining physical health. Also, policymakers could extend health resources such as park in deprived area. If you forgot all the details of my talk today, you just need to remember these take-home messages. Becoming unemployed improve physical health among people in less deprived area, but reduce physical health among people in deprived area. Thanks for listening. Please don't hesitate to ask me questions. I will answer them in Q&A or just write me email. Thank you.